So, ladies and gentlemen, for our keynote address, Healthier Singapore, Insights and Experience, we will be inviting to join us His Excellency Mr. Ong Ye Kung, the Minister for Health Singapore, who will be joining us virtually today. We've been online actually with Singapore for the past few minutes. I think we are ready to receive. Your Excellency, welcome. It's great to have you with us. We'll hand over to Singapore.
Thank you. Dato Sri Satya, Dr. Awang Haji Muhammad Amin Liu Abdullah, Dato Sri Satya, Dr. Haji Muhammad Hisham bin Haji Jafar, ladies and gentlemen, thank you for inviting me to this second digital public health conference. Unfortunately, I'm unable to be with you physically in Brunei. I'm glad that I can speak to you virtually and live alongside representatives from various regions. As the dust of the COVID-19 pandemic settles, healthcare systems around the world will once again revert to the central challenge of our times, which is rapidly aging populations across By 2030, for the first time in recorded human history, the old will outnumber the young. In fact, East Asia is any other part of the world due to declining fertility and people living longer lives. Today, aging is a key, but not the only factor driving the increasing incidence of non-communicable diseases. In Singapore, we have been seeing a rising prevalence of chronic diseases such as high blood pressure and high blood cholesterol among Singapore adults, alongside other concerning trends such as obesity. In the coming 10 years, in disease burden, the impact will be felt across individual lives, families, neighborhoods, and also employers and companies. Families will find it challenging to cope with taking care of their aged loved ones. In the community, we expect vehicle traffic to have to slow down. The green phase for pedestrians need to be longer. Every nook and corner in the neighborhood needs to be curb-free and barrier-free. Hospitals need to cope with significantly high patient load, and governments need to ensure that it can afford its healthcare budget. We must move quickly to address this challenge. Singapore has built a strong foundation for our healthcare sector. We expanded the capacity of our healthcare system. We strengthened the capabilities of our healthcare workforce through expanding education and training opportunities, and have been promoting healthy living. We will build on this through Healthier SG. This is a major national strategy to transform our healthcare system, to shift our focus from curative care to preventive care, from hospitals to community care. This is essentially to put our healthcare system on a more sustainable footing. Some commentators thought this is the biggest healthcare reform in Singapore for the past 50, 60 years. Let me briefly explain what Healthy SG entails. There are 5 key components. Number 1, we are mobilizing our family doctors from both public and private clinics to deliver preventive care to our people. In Singapore, family doctors are trusted nodes who provides accessible care in the community. So throughout the COVID-19 pandemic, many of them played a significant and critical role in our public health response. Under Healthier SG, we want to retain that. We want to mobilize them to build strong relationships with all their patients and play a bigger role in preventive health. Second component are health plans. Under Healthier SG, family doctors will guide their patients to develop a personal health plan. And this plan will focus on the health status of the patient, health goals to achieve, and also an action plan that the patient can undertake. And this action plan will typically center around preventive health, such as completing essential health screenings, taking your vaccinations, and picking up healthy life habits, such as good diet, adequate sleep, and exercise. Third component, we will work with community partners to support residents in leading healthier lifestyles. Because improving health goes beyond just seeing a doctor. It is not easy after seeing the doctor to follow diet plans or exercise advice to improve lifestyles by ourselves. Community partners can create a supportive environment for healthy living and organize health-related groups and activities to help to journey with us in this pathway to better health. Fourth component, the last three components will come together as a national enrollment program. Singapore residents will be invited to enroll with one regular family doctor and build a long-lasting relationship with them. For residents who are healthy or experiencing an early onset of chronic illness, their family doctor will support them to remain healthy for as long as possible. As for residents who already have chronic conditions, their doctors will support them in preventing or delaying illness progression. And for those who require more medical care, their doctor will work with their specialist doctors to manage their conditions. In short, family doctors will support and work with residents to improve their health or maintain their health, and not only step in when there are acute symptoms. Finally, the fifth component, we will strengthen what we call system enablers. And these are things in the background that we do not see. For example, we need the right financing system, such as through capitation funding, to provide the incentives for healthcare providers to focus on preventive care. Another significant enabler is the IT system. We need a robust system to collect and share patient data safely and securely to pave the way for an integrated care model that can also foster team-based care, improve the way primary care providers interact with their residents. This is the backdrop of the central challenge we face and the response of the Singapore healthcare system. I took some time to explain this because it is within this context that we are also making a major push for digital health. I want to touch briefly on four aspects of digital health innovation. First, powering healthcare through centralized IT system. Second, leveraging individuals' effort through digital technology. Third, raising productivity through telehealth. And fourth, harnessing breakthroughs in medical science. First, to drive integrated and seamless care, we need to power the national healthcare system with a few strategic, mission-critical, centralized IT systems. In Singapore, one such system is the NEHR, National Electronic Health Record System. The NEHR captures the summaries of patients' medical records in a central platform that is accessible by licensed healthcare providers. We have enhanced the system to improve the collection and sharing of summarized medical data among such healthcare providers. They include family doctors, hospitals, community care partners such as nursing homes. Patients in turn has a window into the NEHR to access their own medical data through a mobile application, a web and mobile application called the Health Hub, with expanded access to records such as their screening results and their health plan under the Healthier SG strategy. To facilitate the proper collection, use, and sharing of health data amongst healthcare providers in a safe and secure manner, we will introduce a new legislation, the Health Information Bill, in 2023, next year. The bill will mandate licensed healthcare providers to contribute patients' summarized medical records into the NEHR and in turn able to access patients' health data by their care teams across different settings. So you put in your patient's data, in turn, you can see all other patients' data whenever they come to you to seek help. The new legislation will also mandate data governance, IT, and cybersecurity capabilities by healthcare providers and data intermediaries. The fact is, we cannot view healthcare just as a hospital activity anymore, because that is not healthcare, that is sick care. Healthcare happens in homes, at workplaces, and in the community, in our day-to-day lives. And for that to happen, medical records, data, it needs to be accessible safely and securely across settings and healthcare providers. The second digital innovation in healthcare is to leverage individuals' effort. Ultimately, each of us are responsible for our own health because we are the biggest and the most consequential stakeholder. Yet, most of us visit our doctors infrequently, once a year, once every half a year. We may abide by his advice for a few weeks, and then we slack off after that. We lack the medical expertise and knowledge, and especially the motivation to continue the course and stay healthy. Digital technology, however, can now change that. It can be used to empower and motivate individuals to take greater ownership of our health. Wearables, for example, it comes in many forms now: watches, necklaces, rings, even t-shirts. And then they are paired with a mobile app. And with the two working in tandem, they encourage us to adopt healthier lifestyles, eat better, exercise more, sleep more soundly. After the COVID-19 pandemic, we have a great opportunity to promote the use of such digital health apps and wearables. All over the world, people after the pandemic, they are now used to checking COVID-19 test results or vaccination status using a health app, which has become a must-have in our smartphones. Now we can use these digital companions to help individuals take steps towards better health. It will be a powerful multiplier for our Healthier SG strategy. Singapore has a head start in this. Years ago, we developed an application called Healthy 365, which allows signups for healthy lifestyle programs, as well as easy tracking of lifestyle data, such as physical activity and healthier food purchases. With the Healthy 365 app, residents can also participate in the National Steps Challenge. This is the world's first population-level fitness tracker-based activity to gamify physical activity and to reduce sedentary behavior. Today, 1/5 of our adult population participates in this National Steps Challenge. So by clocking steps, engaging in moderate or vigorous physical activities, they can earn health points, which can be used just like air miles at various participating merchants to exchange for goods and services. Additionally, we need an open architecture which promotes system interoperability and compatibility between wearables and digital health apps like Fitbit, Apple, Garmin, Samsung, to allow consumers and patients to adopt and use these devices as part of their daily lives, and yet compatible with Health 365 so that they can continue to participate in the National Steps Challenge, earn points, and be rewarded for living a healthier life. Third point, we can achieve a significant leap in productivity in healthcare delivery through telehealth. Telehealth and teleconsultation, telemedicine, had not been well accepted in Singapore. However, during the pandemic, we established telemedicine systems and processes for those recovering from COVID-19 at home. And so today, telehealth is well accepted, and patients begin to see the benefits, that it is convenient, very accessible, and the doctor can be almost equally personal and attentive to the patient. We should make telehealth the norm in our healthcare delivery system. It will raise productivity tremendously. And this is especially important for an aging society where the mobility of patients can be a challenge. Telehealth will expand the capacity of our primary care system to manage patients with chronic conditions and improve their outcomes in a very cost-effective, accessible manner. At the same time, home delivery for medicine and contactless transactions can also become part and parcel of the new normal. During the pandemic, we deliver medication oximeters to COVID-19 patients. We are in the process of developing the centralized pharmaceutical distribution system, which can make telemedicine even more attractive and convenient. Finally, and possibly the most significant of all innovation, is to harness the breakthroughs in medical science. The possibilities are many, but let me just cite two examples that are just over the horizon. One is the increasing use of artificial intelligence, or AI. AI can enable our healthcare workers to better care for their patients. For example, in the area of early diagnosis, the Singapore National Eye Centre, Singapore Eye Research Institute, and the National University of Singapore School of Computing, they jointly developed this AI system called Selena Plus. It stands for Singapore Eye Lesion Analyzer Plus. It uses deep learning models on retina images to detect diabetic retinopathy and has been deployed to 23 polyclinics and reading centers. The system helps to overcome our shortage of trained healthcare professionals and detect high-risk patients early to prevent future blindness. Two is the powerful convergence of digital technology and bioscience. Genetics is not a new field of science in medicine, but in 1990 there was a breakthrough. The Human Genome Project generated the first full sequence of the human genome. It is literally a human blueprint, which is in turn made up of billions of DNA pairs, each of which in turn comprises of 4 chemical bases, A, G, C, T, as building blocks. In other words, humans are not very different from a very, very complex set of computer source codes. In the years and decades to come, we will bound to see convergence of digital and bioscience technology, and it's already happening. We have already witnessed the record-breaking speed in COVID-19 vaccine development. Scientists are now working on a 100-day project, which is the targeted time taken to develop a vaccine for the next pandemic. And this is possible because of the mRNA technology, where vaccines are literally programmed like a software to be upgraded to fight new pathogens. Hence, in Singapore, we have started administering the Moderna bivalent vaccines, which protects against the wild type plus the BA.1 variant, an improvement from the original vaccine. And soon, we will have the Pfizer bivalent vaccine, which protects against the BA.5 subvariant. I commented to a colleague recently that vaccines development now is almost like upgrading our smartphone operating system software, version 15 to 16, 16.1, 16.2, etc. I think this is just the start of the revolution. In time, there will be treatment and therapies intervening at the cellular or genetic level for various diseases. It will also be possible to sequence the genomes of individuals to find out their health risk with age. The possibilities are tremendous, are exciting, but also poses many difficult legal, moral, social, and financial challenges and dilemmas. And this will preoccupy policymakers for many years to come. I thank you for giving me this opportunity to share some of my thoughts. I thank the Ministry of Finance and Economy and the Ministry of Health in Brunei Darussalam for hosting this conference, and I wish all of you an enriching and thought-provoking day ahead. Thank you.
Thank you so much, His Excellency Mr. Ong Ye Kung, Minister for Health in Singapore, for joining us virtually.